that's it. So I think we are live streaming on Facebook now. Warmly welcome Dave Watson from Scotland, formerly associated with UNISON, the largest trade union for adult care workers and social care workers in Scotland. I have invited you because you have just released a report on the Corona Frontline, the experiences of care workers in Scotland during the pandemic. And this report is part of a series that is released together with the Friedrich Ebert Foundation. The starting point of this series of reports is, of course, that across Europe, the coronavirus pandemic hit the elderly very hard, and particularly those in elder care, placing care workers on the Corona frontline of an underfinanced, understaffed, and undervalued care sectors. Years of austerity policies and neoliberal new public management have increased the level of privatization and precarization, but at the same time also decreased the rate of unionization. The report that you have written about Scotland is a report from this coronavirus frontline, and it's a report as well that summarizes the experiences of care workers who have organized in trade unions and how they have been able to use their membership in the trade union to make a difference, not only for themselves, but also for the people in their care. You're warmly welcome, Dave. I will give you the floor now to make a presentation. Everyone that is following this on Facebook Live now, remember you can ask questions whenever you want, just post them in the Facebook event. If you feel uncomfortable posting them in English, just write your question in Swedish and I will try translate. The floor is yours, Dave. Welcome.
Lovely. Thanks very much indeed, Lisa, and our thanks from Scotland to the foundation and yourself in particular for writing the overview report. In many ways, what I'm about to say is probably not news to anybody in Scotland, but where we found the report particularly useful was seeing the experiences and hopefully the lessons from the rest of Europe. Sadly, I'm afraid they were all pretty similar in many ways, and also as we're arguing at the moment, and certainly the main trade unions are arguing for public inquiry into the pandemic, not just to apply blame, but to learn the lessons, because we all know this won't be the last pandemic that we face in Europe. So I think the lessons learned are important, and I think reports like this are a very important element of those lessons to be learned. So what I'm going to do tomorrow is show you a brief presentation which sort of runs through some of the key stuff in my report, and then obviously happy to take questions, etc. afterwards. So so first of all, I inevitably, because this is a report for a lot of countries across Europe, what I've tried to do in the report is to highlight how social care and the health service is organised in Scotland, particularly how it's different to the rest of the UK, because people will obviously be somewhat confused given that Scotland is part of the UK. But health and social care is what we call a devolved service. So our systems and the way we run these services in Scotland are very different to the way they're run in England and the other nations of the UK. Where we've been focusing in the...
I can't see your presentation.
Oh, sorry.
Yeah, you should share the screen.
Let me try that again.
Little detail. Yeah, that's right.
Okay. Let me just
go into... Yeah, excellent. Thanks.
Good. Okay, right. So in terms of health and care integration, which is where we've tried to be, it's a rather busy chart, but obviously you'll be able to pick it up from the report. So essentially, this shows how we tried to do it, and we tried many ways to really pull. The health service is a fully public. There's a very small private sector in Scotland, so the health service is a particularly a public health service. The social care system, however, is much more fragmented. It's more public service than it is in the rest of the UK, but still there's quite a big private and charitable sector engagement in social care. So what governments for many, well, ever since devolution in 1999, governments have been trying to integrate the two. So we have what they call a seamless service between them. And the current model of that is what we call integrated boards. So they pool the budgets, run most of the NHS and the social care services, which are in the main commissioned and run by local authorities. I've just put a few statistics in there to give you a flavour. It's not just give you the balance there, the 40% private, the 30% public, 30% voluntary. That's in social care. It's 98% in the NHS and the normal health service. But particular issue in this, you can see, is the 3/4 of care homes. These are the residential provisions are privately owned, and they're the ones that have had some of the biggest issues during the pandemic. So as with the rest of Europe, you can see that most of the paid staff are women. Scotland doesn't have a big black and people of colour population, but still they're disproportionately represented in that workforce force as well. And of course, not to be forgotten, there are, for a country of just over 5 million people, we have 800,000 people who are what we would call informal unpaid carers, and they shouldn't be forgotten either in this pandemic. There's a section in the report about employment standards. So what I've tried to do there is explain how workers in the social care sector are employed. There's collective bargaining right across the public sector, and there is some in the private sector and a fair bit in the charity sector, particularly the larger charity providers, the better employers have collective bargaining, but it's not one single overriding national bargaining position. So it's national bargaining in the public sector, it's employer-based bargaining in the private and the charity sector, although that's likely to change fairly soon. What is common and is unique to Scotland is that we have a thing called the Scottish living wage. This is not the statutory minimum wage. This is a voluntary rate, which is higher than the statutory minimum wage. And what the Scottish Government, unions and employers have agreed to do in Scotland is to put that as a minimum requirement in all contracts. So it's essentially not enforced by employment law, which is reserved to Westminster, but it's incorporated in the contractual arrangement. So a local authority commissioning a private or charity provider to deliver social care would make it a requirement they paid all their workers that rate. So that was a very important development a few years ago. It hasn't always been implemented well, and we've had some challenges over things like sleep-ins and so on, but nonetheless, that was an important boost to pay in the sector. And that's important because essentially, like elsewhere in Europe, this type of work tends to be undervalued. We would argue primarily this is discrimination against women and people of colour, but nonetheless, that is the reality. Trade union density could be higher. It's probably about 3/4 in the public sector, but much lower, as you can see, in the private and the voluntary sector. This is not least because of some of the recruitment challenges that trade unions have had over many years in the public sector as much as anywhere else. Partly it's because it's a disparate workforce. We have some 1,000 different social care providers, which for a country of over 5 million people is ridiculously high. So a lot of them are very small and geographically spread. There's a very high turnover in the sector, in some parts of the sector, well over 25%. So a quarter of people leave the industry every year. And obviously that creates itself, if your workforce and your reps are turning over very rapidly, that's much higher, by the way, in the private sector than it is in the public sector. And in the private sector, particularly in some of the charity sector, sadly, there are some hostile employers who have reacted badly, although some of those have now been brought into the net by the contracting arrangements. Again, the rest of the UK is starting to catch up now. But Scotland also has registration. This is professional registration. It's always been the case for degree level qualifications like nursing, etc., but not for basic grade care workers. That came in a couple of years ago, and that increases standards. But as yet, not everybody is qualified. The requirement is that people are working towards, which is obviously a little lax. But hopefully in the next few years that will pick up and everybody will get at least a basic level of qualification. So the report then goes on to talk about, and I think it's very important if people take nothing else away from this, is that all the problems facing the social care sector didn't just appear when the pandemic hit. These were long-standing problems with the sector which hadn't been addressed by governments for many, many years. Some of them are fairly obvious, like aging population, an increase in chronic and multiple conditions, and healthy life expectancy has actually tapered off, and in some parts of the more deprived areas of Scotland, it's actually been going down, which reverses a trend, almost a century-long trend of life expectancy going up. And that was before the pandemic, I should emphasise. So the financial pressure on the sector has been great. Yes, some things have been done, but Scottish Government's own financial projections show a £683 million gap, which is pretty significant. I've talked about fragmentation, and various reports have been done. I won't go through them, but various reports have been done about how integration has not really happened. It's happened partly, but there's a long way to go. Not least, leadership in the sector has had an even higher turnover than the staff, which is pretty unusual for any industry. We've got very little progress on workforce planning. It's pretty good among professional jobs in the NHS, but very poor in the social care sector, and that's partly due to the fragmented nature of the workforce. And we've had some procurement challenges getting the weighting right in the tender bids, and there have been delays in paying the living wage. And there was a big report by the Fair Work Convention that I've referenced in the report, which highlighted some limited progress in these areas. So the pandemic, I'm afraid, has rather highlighted these challenges and in many ways exacerbated them. We had the first wave very high in Scotland, higher than the rest of the UK, and I think looking at your report, probably the highest in Europe. Numbers of deaths happening in care homes. And this was largely because care homes of an untested patients being discharged very early on, before the government realised the mistake and changed the guidance. But not just in residential homes. It's often been forgotten that actually home care packages were abandoned, very large and reduced, although that is now recovering. And one of our main elderly care charities has highlighted their view that there's been a 25% increase in excess deaths through other conditions as a result of losing those sort of home care packages. Obviously, the COVID has cost a lot of money. At the moment, they reckon about £422 million. That's on top of the gap we've already got, and that's still not clear how that's all going to be funded. We had all the problems that elsewhere in Europe about poor personal protective equipment, and staff were not routinely tested for at least 4 months, and therefore surveys by UNISON and others showed that only about 18% of staff actually felt safe at work. Sick pay was a big issue. Again, as I see in your report, it is elsewhere in Europe, that whilst we've got the Scottish living wage paid promptly for the first time, we had to essentially negotiate a sick pay support fund and other benefits, because people were only getting the statutory sick pay, which is very low. Plus, we had all the problems about agency staff working in one or more workplaces with the risk of them being spreaders of the virus. There is a commitment to public inquiry, both in UK and in Scotland, but not surprisingly, governments are not in any rush to do that. But I think most of the trade unions now argue it should happen sooner rather than later. The trade union response to the pandemic, in all the organising challenges I highlighted earlier, obviously are exacerbated in a situation where you can't actually physically get out and meet workers. So it made it more difficult. So what most of the trade unions did, and quite effectively, was essentially to beef up. They always had an online presence because that was a way of reaching this workforce, but they moved online in a much bigger way. They use all the online presence, Instagram, Twitter, but Facebook would be the main one, because it's easily accessible, particularly to care workers who may not have good broadband and computers at home, but do often have a mobile phone or a smartphone because they need it for their work. Sadly, not always paid for by their employer, but as it should be. But nonetheless, it gives a tool for doing that. As a result of that mobilisation and negotiation, I think there were a lot of very good victories that were achieved by the trade union movement in Scotland. Getting the Scottish living wage paid immediately and not a sort of 6-month delay, why interminable contract negotiations went on between the local authorities and the care providers. Making sure that happened quickly was important. Getting a sick pay fund shouldn't be necessary because people should be paid full sick pay, but nonetheless, that at least plugged some of the gaps to ensure that workers didn't come to work when they should be self-isolating because they couldn't afford to do anything else. Death benefits improved. COVID tests were introduced at a time when government was not keen to do them, and a big improvement in personal protective equipment. Although even today, it's not perfect by any means. And generally improved recruitment. Most of the unions managed to improve density during the pandemic. More workers recognised the benefits and came to the trade union online resources very much to get that independent advice, which was crucial at particularly the early stages of the pandemic. Finally, talk a bit about reform. There was an effort before the pandemic to reform social care in Scotland. But there were lots of task groups and working parties. I somewhat cynically say in Scotland we do process very well. We don't always do action very well, sadly. So yeah, government's pretty good at setting up task forces, but not quite so good about implementing things. So the main focus of the Labour and trade union movement has been the campaign for what we call the National Care Service in Scotland. This would be not an equivalent of the NHS. This would be a framework, but with local delivery, and polling done by a number of organisations have indicated very high level of support for that. The other requirements to end the market. This doesn't mean necessarily all public service provision, but certainly ending the contracting and so on, introducing collective bargaining, improving clinical standards and getting some workforce planning in place. But there's still a debate to be had on some of the models of care, how we should deliver care locally and what the governance arrangement should be for that. So a big issue, particularly in the residential sector, was about removing some of the fragmentation of care. I'm certainly dealing with tax dodging. Quite a lot of residential homes are run by big care firms who are based in tax havens, sadly British ones mostly, in the Cayman Isles and places like that. So those are the sort of requirements. In response to that, the Scottish Government commissioned a thing called the Feely Report, which is just report, and I just squeezed a brief paragraph in the report on that at the end. Most of the report is dated as sort of end of September last year, but squeeze this in. So this has been essentially a very detailed report which has been broadly welcomed by the Labour movement. It's strong on human rights, on assessing needs and dealing with workforce issues. Where it's weak is that it's proposing to centralise the structure, and some have argued that it simply takes the current structure and sticks a minister on top of it, which is not the way to run local services. It doesn't really tackle privatisation, and it ducks, frankly, funding. It gives you a bunch of options, but not much else. So funding will be an issue, how we're going to pay for that. So there needs to be a real discussion about taxation and the issues. Sadly, unlike Scandinavia in the main, there's a view in Scotland you can have the same level of public services, but on American levels as taxation, which isn't practical and can't be done. So where we do that. And we also need to remember that one of the reasons for local delivery is that social care doesn't operate in isolation. You have to think about housing and other public services in the same context. So in conclusion, there have been many attempts to reform social care in Scotland, pretty mixed ones, to be honest. It was in crisis before the pandemic. The pandemic's highlighted that and flagged up some new ones. Much of the preparation for the pandemic, which had been tested and exercised, wasn't implemented. There's been a strong trade union response, and I think there is an appetite now for reform. The outline of that is there. The difficult political decisions are now up to the politicians to take, and hopefully, certainly after an election, it was a good time to do radical things. Let's hope the politicians grasp the nettle and take those reform measures. Thanks, Lisa. I'll stop there.
Thank you so much, Dave. I should remind the listeners, I forgot to mention that in the beginning, of course, this report has been produced in a project that is funded by the Swedish Municipal Workers Union Kommunal, which is the sister union of UNISON in Scotland and in the UK, and by the Friedrich Ebert Stiftung, which is a German progressive foundation with offices across Europe. And yours is the first report to be released, but there are 8 more to come. So there'll be a report on the rest of the UK as well, and we're releasing a report on the situation of care workers in Spain, in Portugal, in Germany, and in all the Nordic countries. There'll be one from Sweden, from Finland, from Norway, and from Denmark as well. So viewers now can have a lot of reports to look forward to. So you mentioned many issues, Dave, and there are so many things that we need to talk about. And I think there are many things in which Swedish elder care sector could be inspired by the Scottish attempts at reform. And I can understand your frustration that it's not moving fast enough, but I still think it is inspiring to think of elder care as something that could actually be organized in the same way as the NHS, that you can actually have a national care service that is organized by the public, paid by public money, not privatized, fragmentized as elder care is now. Are you optimistic that this is possible to bring about? Will there be a national care service, as you said, as a framework for then local delivery?
I'm optimistic there will be a national care service now. I think there's a cross-party consensus in Scotland that's the way forward. I suppose the challenge is, what type of national care service will that be? You know, having a name and having an outline organisation is all well and good, but it's only a structure at the end of the day. What matters to carers and the people they care for is that structure delivers a better level of service and a more responsive service to the user. So I suppose the people are pretty broadly agreed that we need to have at very least a broad framework which introduces some consistency, that does away with charges, that does away with the dafter aspects of the attempt to introduce some sort of commercial market in the sector. So longer term contracting arrangements, less of that type of competition and more collaboration between providers. I think there's a broad consensus on that. There's a broad consensus that human rights should be the basis for assessing need. So instead of at the moment when it's essentially a ration system, depending on how much money a local authority has, moving towards a needs-based assessment, I think there's a good consensus around that. Most helpfully, from a trade union perspective, there's a real consensus that workforce needs to be sorted out, that we need to value the workforce. There needs to be national collective bargaining for the workforce for those who currently don't have it. And also we have to have workforce plan. We need about 25,000 extra social care workers in Scotland over the next sort of 3 to 5 years, and it's an aging workforce as well. Younger people are not in the main attracted to it, so we need to do, and we need to tackle gender segregation as well, because it's predominantly female and basically men need to work in this sector as well. So all of those things, like there's an agreement on. Where there's, I think, a battle to be had is that essentially the battleground area tends to be that the current Scottish government, the SNP government, tends to favour the centralisation of public services, running them from Edinburgh, whereas other parties, particularly the Labour Party, favours local delivery of services. So there's a political difference of view there, and that is reflected amongst some of the other broader organisations. Some people want more centralisation and more consistency. Others want more local delivery as well. So I think it's more about the sort of structure, the doing, as it were. So I think that will drift on. Hopefully, however, we can at least get some of the things we agree on implemented, and then move on to the more difficult things later.
I will want to move further down into the workplaces and also talk more about the victories of the trade union and the organising during the pandemic, because I think it's extremely important that we would spread those examples and be inspired of them. I just have one question to you before, because obviously in all European countries we are facing the same challenge of the care sector having to expand enormously in the years ahead, and it being quite a non-attractive sector for people to work in. As you were mentioning, a turnover of 25% of people entering the sector and then leaving it again in one year, and this is the situation now. How will you recruit the people that need to work at it in a decade's time? Now, I don't know if to what extent this has been an argument in Scotland, but in Sweden there's definitely the myth of privatization in itself making the sector more attractive. So a main argument of the pro-privatization and indeed of the private companies who've settled into the care sector has been that by being alternative employers, they would offer better conditions for their workers and thereby help attract people to work in the care sector. So this is a main argument is kept repeating. We are an alternative employer by competing with a public employer that offers bad conditions, bad pay, blah, blah, blah. We will, compete with the public sector about the scarcity of the workers, and we will then make the sector as a whole more attractive. In my mind, I think this argument is, it's a dead end, and the pandemic proves that this is not true, because when you look at the statistics, it's people who have been working for private employers who have been more exposed to the virus, who've had less access to personal protective equipment, who have been lower paid, and who have had less opportunity to organize in the local trade union. As you mentioned, some 70% of public employed care workers are in the trade union, whereas just some 20-25% of those that have private employers. So is this argument about being a more attractive employer present in the Scottish debate as well?
Well, I mean, I suppose it's not really a benefit, but I suppose the reality is that we've tried the market route in Scotland. Certainly, when I was last in Stockholm, I was talking about the NHS experience of how we moved away from the privatisation and the marketisation of the NHS. Social care, essentially that continued, and so our experience in Scotland, I think, is very clear, and I don't think, to be honest, even the private sector providers would dispute the fact that what it led to, they would argue, it was the way the contracts were handed rather than pure privatisation, in all fairness to them. But the reality is that what it did was create a race to the bottom. It did anything other than what we call levelling up. It levelled down. And so what happened in Scotland was that essentially paying conditions went down in the sector. But because local government has been underfunded for many years through what we call austerity funding from UK and Scottish government, that a lot of local authorities took the opportunity to try and save some money by outsourcing. Now, this was bigger in England than it was in Scotland. A lot of Scottish, particularly Labour authorities, resisted that in Scotland, but nonetheless it happened. And we therefore saw this reduction in paying conditions in the private and the charitable sector. They would argue in response to the price that they were being given for the contracts but nonetheless, the system drove those down. So the consequence of that was that actually it's not an attractive sector for particularly younger workers. What you tend to find when you interview, and I've done countless focus groups with care workers over the years, what you tend to find is that older workers say, I'll probably stick it out until retirement, and younger workers say, get me out of here. I mean, bluntly, younger workers say things like, I can earn more money stacking shelves in Lidl's or or Aldi or Tesco's or any of our big supermarkets than they can working in the sector, which is very difficult, and it's hard work. It has lots of attractive features to it in terms of working in the sector, but when you're getting paid worse for doing a tough, hard job, then it's pretty difficult to attract people into it. So what we found was lower paying conditions, high turnover, as I mentioned earlier. I mean, in one of the admittedly one of the worst charitable, not the private sector, but I was dealing with, they were having 40% turnover of staff a year. Now, anyone in the care sector knows consistency of care is important. You do not want, particularly with elderly folk, you do not want different people turning up every week at their door. And I spoke to one elderly gentleman who said he had 8 or 9 different carers in almost as many weeks. He said he literally had to say, can you show me your badge? Because normally, nobody would ask a care worker to see their badge because it's the same person. They say, oh, here's Mary, but that's the sort of problem we had. If you have 40% turnover, and the cost of that as well. I mean, you've got to train them, you've got to recruit them, you've got to advertise, you've got all of those things. And also our experience was that training standards just crashed. I mean, literally people were being thrown out onto the streets to go and care for people with half a day's training in some cases, literally signed on their tax and employment details, sent out into the care sector.
So the experiences of Scotland and indeed I think for the rest of the UK is that increased privatisation has leveled down the working conditions of the care workers, not the other way around. We have Lars asking here, what about the public support for your market-free model of the NHS? Has the pandemic lessened or strengthened the support for the NHS?
It very much strengthened it, both the NHS and the idea of getting the market out of social care. I mean, to be honest, even our right wing or our conservative politicians essentially buy into an understanding that market, there are some areas that the market doesn't work very well in, and social care is one of those. So other than some people on the far right, in the main, even mainstream conservatives would accept that that's the case. And the polling that's being done by the public has shown definitely support there. People do not want to see the profit motive driving in the care. They can see the weaknesses of that model.
Thanks a lot, Dave. We have a question coming in from Jerry Mitchell, who is authoring the report about the rest of the UK. She says, how do we discuss all this with the public? How do we get the message out there post-pandemic? We know there are low levels of understanding. What is your answer to that, Dave?
Yeah, it's a very fair point. One of the reasons the NHS in Scotland is so popular is because virtually everybody uses it. From millionaires all the way down, people use it. I mean, essentially, if you're a millionaire and you're in a car crash, you'll end up in an NHS hospital. All right, if you want your varicose veins dealing with, or you want some cosmetic surgery, you might go to a private hospital. But essentially, people, now that means you get a very broad level of public support for a public service that everybody uses. Public services that people less use inevitably have lower levels of support, and inevitably, and while social care is pretty widely used, it's still relatively small, given that actually most care is done informally. It's done by relatives and friends and others. The 800,000 people I refer to, sadly, including a lot of very young people. We shouldn't forget that. Essentially, children caring for their parents. And we need to do a hell of a lot more in that sector as well. So I think that is a problem that most people don't experience the social care sector directly. They don't have, they themselves and their relatives may not be in residential care. they themselves and their relatives are not in receipt of publicly funded care packages. But obviously we have an aging population in Scotland. The only way we've actually kept the population rising has been through migration. And of course, that's a challenge because of sadly coming out of the EU and UK government migration policies, which they're now having to roll back on because of the impact on the NHS and the social care sector. So we have all of those challenges as well. So I think that is a problem. So, but obviously the pandemic in many ways has highlighted particularly the care home deaths. I mean, it has been the biggest scandal in Scotland for arguable, certainly since devolution. One of the authors of a recent report used, essentially said this has been the biggest scandal since devolution, and we've had a few, but this has been the worst, and that I think has highlighted people's attention. I think the challenge for us is to build on that, because people's memories drift, and as the vaccination, which has been very successful in Scotland and the UK, kicks in, people start to forget these things, and therefore the drive to make reforms starts, particularly when they're expensive and require a lot of public support to make the difficult financial decisions as well. So I think that's a challenge for us, but I think reports like this and other initiatives are very important in terms of keeping the issue in the public eye.
I have another question related to how we now, as we hopefully move into post-pandemic times, can use the experiences made during the pandemic. I think you highlighted in your presentation the extremely important victories for the trade unions in the adult care sector, was making sure that everyone could access personal protective equipment. It was about testing, everybody having access to testing. You also made sure that people could have access to sick benefits, so that staying at home while sick was actually a recommendation that people could actually follow. And you also worked to have a death benefit fund for people who were infected and actually died from the virus, an infection that they got at their workplace. So we know all of these victories were extremely important, of course, for the health and safety of the workers themselves, but also essential for protecting the elderly at the care homes or in the domiciliary service, because by staying at home when you're sick, by having access to testing, by having access to personal protective equipment, you could also protect those that were at your care. How to remind the public and politicians after the pandemic of this extremely important role that local organizing in the workplaces and the trade union organizing had, and what are the lessons to be learned? Is there something that politicians can do to strengthen possibilities for trade unions to be strong and active at the workplace and in general in the policy debate as well?
Yeah, I think there's a range of things. I think the first thing to be said is that we should pay credit, and in particular I want to pay credit my former colleagues in UNISON, particularly the staff and the activists who frankly, and there is an issue, to be honest, about post-pandemic, about burnout not just among care workers and NHS staff, but also about trade union organisers who have gone way beyond anything. I mean, I know colleagues that were working almost throughout the night on occasions to make sure they got the latest advice, understanding very complex issues. I mean, understanding about a pandemic, trade union officials are not immediately experts on how viruses, move. You've got to read all the conflicting science around this. If government struggle, then trade unions obviously have an issue there as well. So there is an issue about capacity in trade unions to respond to that. And lay activists in particular, did an amazing job and stood up at times when many of their employers were saying, oh, don't make too much of a noise about this and please be quiet, and it's not our fault, and so on and so forth. So yeah, I think that's an important lesson to be learned, particularly for trade unions, to support their staff and their lay activists to ensure that they get a chance to recover as well. I think the the organising lessons, I think, have been learnt, not least the successes have delivered in terms of better organisation, as well as obviously, recruitment, which is obviously essential. The more people you represent, then the more effective you can be in the workforce. So I think those lessons have been learnt as well. I think also government and politicians can help. The key thing, I think, is that given that most of these services, I mean, we have a problem in large parts of Scotland over low wages in sectors like the care sector, in hospitality, and some of the rural areas in particular. The thing about the care sector is that most of the money going into it is public money. So the key thing for politicians to understand is that, they may not be able to say directly in many ways, that you've got to do X, Y, but you can, through procurement, enforce that. So we don't need to persuade the UK government to change the law, because we can do it through procurement. So essentially, what the lessons to be learned are government using the levers of procurement to say, right, if you want public money, this is the deal that comes with it. You have to recognise trade unions. You have to allow the sort of organising that needs to go on to do that. You have to pay people at least the living wage, probably higher. You have to have job evaluation schemes that properly value jobs in the workplace. You have to have proper health and safety, occupational health, and all the other things that go in there. That's the deal. Public money will come your way. More public money will come your way. But in return, you have to pick up yourself, and you can no longer be the rubbish employer that many of them were in the past. So you need to move on. And I think so. It's a combination. I think there's no silver bullet or a panacea for any of these things. But what trade unions have to be better organised. Trade unions need to talk perhaps a bit more about, the successes and victories. We're a bit shy. Nobody in the private sector marketing department will be as shy as trade unions are about talking about their successes. We're all a bit reluctant to do it. We need to be better at that. So more shouting about what's been achieved, even if it's not been perfect. But also, I think government movies stepping up to the plate, and instead of saying what they can't do, start to use the levers of government to achieve what they can do.
Thanks a lot, Dave. I think that's a very inspiring message for Sweden as well, because obviously the system is similar with the local municipalities actually controlling the public money, and then being able to, when they commission private actors to provide elderly care, they could definitely raise the social standards and the demands that they have. I think this would work two ways. It would raise standards, and it would also hopefully clean the sector from the worst actors, those that are in there for the fast profits, and who would, send their profits abroad to some tax dodging equity fund, shouldn't have been using public money in the first place, and should stop as soon as possible. So Jerry is asking again about strategies. She asked, what strategies can trade unions going forward to reach more domiciliary care workers? So care workers that work at home. That's a very difficult sector to reach. Are there any good experiences from Scotland that could be shared there?
Yes, I mean, I've talked about obviously going online to a greater degree, and you can visit some of the online efforts that UNISON, the GMB, and other trade unions have used, and that's been effective. You bearing in mind that that obviously the digital divide exists, and lower paid workers don't have quite the same. So it'd have to be very simple. The use of very good messaging about effective memes in social media are important. You've got to catch the eye, so using shorter format stuff, not the sort of lengthy stuff that I tend to write. It's more about the more effective design stuff. So I think using those methods, I think, have been very, very important in terms of doing that. So I think those type of organisations. The other perhaps other tip which I think has been effective is that because we've now moved to the registration and the professional registration of care workers who historically have not been either, if you like, not the degree level care workers, we're talking about the basic grade care workers, because they now need to be registered, then trade unions have moved into that field with trade union learning. So programs whereby trade unions essentially work very often, in fairness, with employers, particularly smaller employers who don't have much in the way of resources, have actually welcomed. And it's one way that, I remember doing a number of deals with smaller care providers, and the trade-off was that we provided some of the learning and essentially encouraging care workers to do the training and to get on board with the registration. So registration brought with it some organising opportunities as well. Trade unions, to greater or lesser degree, have picked those up, and that means that workers who are worried about that, and bear in mind that registration may not be a huge issue if you're thinking of going into the industry, but if you're already there, if you're a 40, 50-year-old long-serving basic grade care worker, the thought of essentially going back to school, as they would put it, is quite daunting.
Yes.
So the trade unions, by helping with study guides and short guides, etc., puts the trade union in the classroom effectively. And we have schemes in Scotland that we do this with younger people, like unions into schools, and we have a union learning programme which is partly funded by the Scottish Government, and that programme is very important in terms of getting our learning reps to work. So there's been a lot of work. We can do a lot more. We're not there by any means, but I think that's been a good organising tip that we found as a way of going forward. The rest of the UK is starting to catch up now with the requirement for registration. So I think unions in the rest of the UK will start to learn to do that as well.
Oh, that's very inspiring indeed. I know that has been indeed a very big victory for Kommunal here, the Swedish Municipal Workers Union, to have an acknowledged professional title of the assistant nurse. Before, only the nurse would have this type of qualification, which meant that assistant nurse did not have a recognized degree either. Some of them had a great education and had attended very good schools. Others are just, by some private provider, not knowing what they did, and a few months of study, and then they could use the same titles. So this is changing, but it's a very good piece of advice, probably happening already also here, that the trade union should be present when this at the places where there's training and retraining happening, regardless of this being young people who train before going out to work, or if it's people who already been in the profession for a while who are gaining new skills and gaining this professional title. So I think we should keep this talk short. Dave, you have written an amazing report with all the details and all the numbers and all the references as well. So we've put a link out on Facebook already for those who would like to read. And Jerry, who's joined us in this conversation, we'll be releasing her report 2 weeks' time. I think it's the 6th of April. We also have a release of the Spanish report coming up during the same day. So we'll be sure to share it here with you. We also are planning for a larger event in the run up to the European Social Summit in Porto in the first week of May. So we're hoping for a lot of attention to care workers who've been on the coronavirus frontline, but are definitely on the front line of care in the years to come as well. Let's hope that we learn something from this pandemic and can go about this thorough reform that trade unions are now working at in Scotland and elsewhere in Europe. Thank you so much, Dave, for joining us today. Thank you.
Thank you, Lisa.
Thank you.